Hello everybody, welcome to today's class. We're going to be discussing Crohn's disease. This is how you spell Crohn's disease. A little bit of a strange spelling, named after a man named Dr. Crohn. Crohn's disease falls into a category of diseases referred to as inflammatory bowel syndrome, otherwise known as IBS. It's a large category of diseases, and most of the diseases within it are autoimmune disorders. Can anyone tell me what autoimmune refers to? Anybody? Anybody at all?
When your immune system is on autopilot.
Not at all. That's awful. No. Autoimmune refers to when the immune system of the body actually attacks the self. That's what it means. It doesn't respond to foreign invaders. It responds and attacks the own cells of the body. Yes?
When you say foreign invaders, do you mean like people from France?
Absolutely not. Bacteria. That would be bacteria. Crohn's disease specifically involves chronic inflammation of the bowel system. Can anyone tell me what chronic inflammation refers to exactly? Yes?
Well, I'm not sure, but what does inflammatory mean?
Inflammation actually refers to the redness, the swelling, and the loss of normal function within the tract, specifically in Crohn's disease. So, it can be in anywhere in the body. Inflammation can be in the ankle if you break your ankle. It can be in the skin if it's infected. It's simply referring to the redness and the swelling that occurs when there is an infection or some sort of mutation or disease. Okay, so onward with the chronic inflammation. It can occur, it occurs in Crohn's disease in the gastrointestinal tract, but it may also occur in areas of the mouth, the esophagus, stomach, and anus. Now, I didn't make it clear. It's usually in the small and large intestine. You guys got that?
Gotcha.
All right. Okay. So this chronic inflammation can cause problems with absorption. Absorption of what? What do you guys think that means? Absorption of
Food and water.
good. Basically, nutrients. It can also cause frequent diarrhea. Nobody likes that. They say that people with Crohn's disease can actually have diarrhea up to 10 to 20 times per day when not in remission, when the disease is active. Can anyone describe what remission means exactly? What would be your best guess, Des?
Remission is when you don't get it anymore.
Yeah, perfect. That's awesome. Okay. Alright, well, would anyone be able to tell me if Crohn's disease is contagious or not?
Hey,
Don't fall asleep in my class. Disrespect. Wake up. Can you tell me? Would you be able to guess if Crohn's disease is contagious or not?
of course it's contagious. It's a disease.
Not true. It is not contagious, but it can be at a higher probability of developing when your family member has it. So it's genetic, and or it can happen out of random chance. Doctors aren't really sure exactly what causes it, but they say some viruses and bacteria can be associated with developing the disease. So it is not contagious. But can anyone just repeat what I just said? What are the two factors that can influence it? First,
Genetics.
genetics. Good. Good. And what other things can cause? There's two little things. They're microorganisms that can cause possibly problems that No. It would be bacteria and viruses. Okay. And that's all for the regular information.
Game! You always beat me, man. It's real.
Yo, I've been waiting for like 20 minutes. What are you guys doing?
Playing a game.
I'm starving. We gotta go.
What are we gonna eat it?
We can eat that burger. You know,
Oh yeah, you got that new monster cheeseburger.
Yeah.
We should go get that.
I'm good.
Alright. Welcome to the grill, home of the super soft pretzels. What can I do for you guys today?
You know what? Just give me a minute, please.
What about you?
I have a double bacon cheeseburger.
Can I get a double bacon cheeseburger?
I guess I'll take a cheeseburger, I guess.
Let me get one classic. Anything else for you guys? Anything to drink?
That's it, man.
That's it? It's on the house. Get out of here.
I'm so stuffed. It's so good.
You know what? I don't feel very good. I think I'm gonna go to the bathroom. My Crohn's is acting up.
What is that smell? Oh, God. I shouldn't have ate that burger. Oh, my God. I hate you, Crohn's. I hate you. I hate you. Ah!
Hi, I'm Des Hopper. With me is Bob Smith, who has Crohn's disease. And tonight, I'm just going to ask him a few questions to get a better insight on what Crohn's disease is and how it's treated. First off, Bob, how did you find out you had Crohn's?
Well, first off, I thought it was a stomach virus. I was actually at work. Everybody at work had like the stomach flu. Everybody was missing work for about a couple of weeks, and mine never seemed to go away. And finally, I went into the doctor, and they did a bunch of tests and told me I had Crohn's.
All right. And when you were diagnosed, did you have any previous knowledge of what Crohn's disease was, and what were you expecting?
I had no idea. I had no idea what Crohn's was. Never heard of it. Didn't know anybody with it, so I didn't really know what to expect.
Yeah. Have you had any surgery or procedures done to treat your disease?
Actually, I have. I've had one surgery called a bowel resection. It's where they took a portion of my small intestine and my large intestine, and then fused them back together. And they took the parts out that were causing all the pain and the inflammation. And that was done in I was diagnosed in 2003, and then my first surgery was in 2006.
So, how often do you take medication, or like what kind of medication are you taking?
Well, the medications, I've been on so many. I just recently started a new one called Cimzia, and I've only been on that for about a month now, and it's a self-injectable. I got to give myself shots to the stomach every 2 weeks. It's not that bad. I did a Humira before that, and that was the same thing. There's all kinds of different kind of pills, and just high maintenance. And if you stay on top of it, it's really not that bad, unless you're going to flare up, and those can be pretty difficult.
Yeah. So, what does happen in a flare-up? How do you know?
Just because anytime you eat, you run into the bathroom. The pain just from eating something gets pretty bad, and it's like your intestines get so swollen. I mean, just the smallest piece of food trying to go through, it just causes a lot of different pains, and it usually ends up in the emergency room, and then they put you on some anti-inflammatories, some steroids, and things like that.
Okay. Well, thanks, Bob. I think you covered what we wanted to go over. So, all right. Thank you for your time.
You're welcome.